because it really is the next frontier. It's what's really going to make a big impact in our lives. AI is definitely not going away. It's going to only get bigger. So I want to encourage everyone to learn about it, to see what it is before they develop an opinion.
He hasn't shined there, my friends. I am your host, Dr. Joseph Allen, and this is the I Give a Damn podcast, brought to you by Fluorescene Media, the same company behind ODs on Facebook. Before we dive into the episode, I do want to give a big shout out to our sponsor, MacuHealth. If you've been following my content, then you know how deeply passionate I am about ocular health, as well as improving and protecting the eyesight of our patients in the clinic. MacuHealth is known for their triple carotenoid formula, lutein, zeaxanthin, and mesozeaxanthin. And whether you're concerned about age-related macular degeneration or just want to help your patients with the nutrients they need to stay sharp, MacuHealth has you covered. We'll talk about MacuHealth again a little bit later in the episode, but otherwise, let's get going. Today, our special guest is Dr. Roya Attar, and today we discuss how artificial intelligence, or AI, is affecting healthcare, including not only how it is currently affecting our profession, but will continue to affect how we practice, as well as interact with other healthcare professionals. In addition to this, we also hear from Roya's personal experience as a professor and director of optometric services for the Department of Ophthalmology at the University of Mississippi Medical Center. So without further ado, hit those like and subscribe buttons, and let's dive in with Dr. Roya Attar. Well, Roya, thank you so much for being here. This is an honor of mine, kind of in a weird way, you and I coming a little bit full circle, being that you and I met originally back like 10 years ago.
Yes.
In an optometry school. For our listeners, viewers who are just joining us, Roya was a year ahead of me, I think. Or was it two? I think you
2
were
years ahead.
So you were a TA for me when I was going through as my first year, like the first few weeks of school as a fresh first year, not sure what's going on. And you were a leader for me even then. So the fact that it came around to this is really cool.
It really is. It really is. Can I tell the story now? Or
Yes.
We're gonna tell it
You go right ahead if you'd like.
Well, we were at Incarnate Word, which at the time, I was part of the inaugural class. You were part of the third class. And so everything was building and a lot of structure was going on. And one of the things that was very important to basically navigate was building our student organizations and student government. And when you were, like you said, I was a TA in lab, and I remember observing you and just the way you were very shy. Like the Joey we know now is not who I met. Let me be very clear. You were very shy, very introverted, very quiet. But there was something about you, and I can't know what it is, but you've heard people say, they've got it. I saw an it in you. Like I just knew that something about the way you spoke, there was a confidence despite your shyness. And so I encouraged Joey to run for SGA president for his class. And he said, we just started. We don't know each other. It's awkward. I said, listen, this is all you have to do. If you do this, I promise you will have everyone's vote. Just stand up in class and say, I'm Joey Allen, and I'm running for SGA president, and say just a few things about you. And I promise when people see that act of leadership, who's bold enough to stand up in front of everybody and do that when you're all so shy in the beginning, it'll make it. And guess who was SGA president? It was you. It was you.
You motivated me. I think it was one of those things where I had already been kind of thinking about that. I knew I wanted to get more involved, but I think you were the voice that pushed me to being like, okay, I just have to stand up and I was called to leadership, more or less. It wasn't me choosing it. I was really called to it. And so thank you for that, because I think that did give me the confidence to start really getting involved, and then the opportunities to get more involved just kind of snowball. Mm-hmm. So to turn back to you, though, Roya, you've done a lot with your profession in the last 10 years, the decade of your career. And I want to touch on that because I think you have a really fascinating story. But I know right now a big topic that you've been passionate in, you have a lecture here right now at optometry's meeting that you're giving. And it's a huge part of not just our profession in optometry, but just life right now as being a human being, is this rapid growth of artificial intelligence and AI. So what can you tell us? There's so much.
There is so much. So yes, I'm lecturing here at AOA, and even between the time I submitted my lecture till tomorrow that I'm actually presenting the lecture, I have updated my lecture again because new things have changed, new things are available to individuals, and my lecture's called AI, the Next Frontier, because it really is the next frontier. It's what's really going to make a big impact in our lives in every aspect, not just for us professionally, but in so many other ways. And I feel that this is so important to speak about because oftentimes when we choose not to adopt something, early or think it'll go away, AI is definitely not going away. It's going to only get bigger. So I want to encourage everyone to learn about it, to see what it is before they develop an opinion. And I think a lot of the people who may not have a positive opinion on it probably have not interacted with it the way that in ways that they can see how much it streamlines so much of our daily lives in so many aspects.
With your kind of research into this, interest in this, is this just purely from a consumer all-user standpoint, or is it more focused on optometry, medical care, healthcare?
Well, because I'm more lecturing in this space, I focus on healthcare and specifically vision care, but in my own personal life, I try to incorporate it in every aspect. And I always encourage everyone to just try it. It's sort of like when you don't like a food and your parent says, hey, just try it, and you'll be surprised. And you always end up liking it. So, for example, we were at AOA leaders meeting earlier this year, and a very good friend of mine, chances are if you go to any healthcare meeting, I don't care what healthcare field you're in, really probably any other profession, usually the keynote address or the big part of it has been AI. It's been all about that. So at leaders meeting, not surprisingly, we had a panel about that as well. And I had someone at the table say, oh no, I don't know about that. I don't want to try that. Right then and there, I had him just say, you know what, let's just start with the basics. Just download what everybody's talking about, ChatGPT. And had him do a few things. I see him at this meeting, at optometry's meeting. He said, Roya, I really want to thank you because I just came back from a week-long trip to Utah, and I just told ChatGPT, make me a 7-day agenda, and I want to go to this park and this park and this park. And it did it all. It told him where he should stay, where he should go. And he was like, I wouldn't have taken that trip had it not been for that. And so if you think about it, what did it do? It didn't do anything that the human couldn't do. It just, all that energy he had to put into that, it's just done. So he could, continue his job, continue his work. But this helped him, take that trip to Utah with his family, get that work-life balance thing, because he didn't have to do all that extra planning. So, even in that aspect. So when it comes to AI, I always encourage everyone just try it. Just try it.
I know ChatGPT's been kind of in the news quite a bit over the last year, so that's an easy one for people to start accessing. I believe they do have free access to some of their older models. People do have a paid version for the newest, most updated ones. What tools are you using in your daily life, other than ChatGPT maybe?
I try to use all the ones that have some type of free version available. I will say that. Something about subscriptions right now, but I will tell you, if once their free version goes away, I would probably give up my Netflix subscription before I would, give up my, ChatGPT or, there's Google Gemini, which is really good as well, Claude. And oftentimes I'll actually do the same prompt in all of them just to see who gives me the best answer. One thing universal about all the AI chatbots, they're very chatty. Okay, it's fun. So properly named chat, but they're very chatty. So condensing it, but having to give it prompts and direction. So I try to use all of those. And I can only imagine as I've delved deeper into this, how much more, if I was in the computer world, how many of these things are open source, which means that you can go get their algorithm and utilize that to basically create whatever program you're creating. Which a few of those in our industry, there's several of those that have already been created that are out there that are open source algorithms for reading fundus images, OCTs. So, our profession, we've known this, it's an image heavy profession, and that is so ripe for artificial intelligence, because by studying the images, it can learn. One thing, and I don't know, I think one thing that will change that I haven't seen yet, a lot of the images that these programs are reading are, traditional, the old fundus cameras. They're not ultra wide field. They're not Optos. So I haven't found a program yet that's been taught on Optos photos. And so that's one thing that I think might be lagging as far as AI, but hopefully that should catch up soon. But it's so much that's out there.
I think you mentioned Claude, right? What's Claude?
It's like ChatGPT.
Okay.
So there's a free version, but it's similar things. You give it a prompt and it kind of tells you,
I know before we dive more into the eye care side of things, because there's a lot of questions I have.
Yeah.
And I've read a little bit into it myself, but I know you've been really studying it. With using just the consumer side of things, I've been just blown away by how many applications AI is falling into. With photos, certainly that's a big one. With video now, with social media even, I use some AI tools that can take my old videos and chop it up, find the exact most highlighted moments that are going to drive the most emotion and people are going to be most interested in based on the AI's knowledge of the internet and what people are searching. It'll transcribe that from English to other languages. It'll put in captions. It'll put in B-roll or images that are outside that I didn't edit. It'll throw in music. It'll generate its own music. It's a little bit creepy, right? Depending on your thought of movies made in the 80s about computers taking over the world or things like that.
But just think about the time that you don't have to devote to doing that, where you could, direct your other talents to. That's really where the value in it is. It doesn't think, oh, hey, let me do this. No, you told it what to do. You are the puppet master. Robots cannot think abstract. So that's or be creative. But, one of the things that frustrates me is, people, it's always the same answer. I'm busy. Everybody's busy. I'm busy. Listen, we all make time for what's valuable and important to us. So if you were busy for, you couldn't answer a text or something, that wasn't a priority. That's okay. But this I think will take away that, I'm busy, I'm busy. So this will kind of alleviate a lot of that kind of busyness for us.
Have you used things like ChatGPT to answer emails?
All the time.
Yeah.
Chances are, if you got an email from me, it's probably written from ChatGPT. Or one of our Google Gemini does a really good job too with my Google email addresses. But it goes in there and cleans it up. All you have is just a quick review. It's really, really nice. And what I wish I could do. What is the one thing, let me ask you this, okay, as a physician, if you ask any eye care provider, what is the one thing you could have that would probably make you could see patients faster or make your clinic day easier? What would be that one thing for you?
For me, it would probably be, other than prior authorization, so let's skip that one, but probably the communication, the letter writing I do for all, not just referrals, but just the communication to other providers. And over time, I've made templates, but still, I want it to be worded just right. I want it to be formal, but professional, but also very clear and direct, not to waste their time. those are the thoughts in my head as I'm trying to write these things.
Right.
And now, I'll be honest, I've used AI tools to help that. And I'll tell it specifically, hey, can you rewrite this? This is how I want it to be directed. This is who it's going to be going to, but I want it to be just like this. Can you give me an example? And I'm like, wow, that's amazing. And then I'll rewrite a few sentences just to make it truly sound more like me.
Yeah. Well, that's one thing. I think most doctors, any profession, we all want scribes. We all wanted a scribe. We want that scribe to do our notes, to click that, because what does that allow us to do? That allows us to talk more to the patient, maybe see more patients, and have not just quantity, but quality. So both improve. It's like, if I only had a scribe. I remember for years just thinking, and that's actually a very rare thing in the optometric world for someone to have a scribe. So there's very few doctors I know that have one. But with AI, it's very, how your future practice could look like. When you go in there, sit with the patient, you will say, tell the patient, is it okay if I have this AI, record this conversation? And based on that, the AI is tapped into your EHR, can go in and fill out your notes. As you call the findings, you call them out. So whatever it hears, it transcribes, and then you'll just go in and review it. It's just like having a scribe that you never really pay, that never calls in sick, that truly doesn't bring their personal problems into the practice. So it's kind of what we've always wanted, essentially. So
I think I've never visually thought of how that might work, but now that you're mentioning it, that sounds awesome.
Isn't that great?
And I think it also will improve the human interaction, because then you're not breaking eye contact. You're not being distracted by, I have to go over here and type on this computer or pull up an iPad. You're able to just engage the entire time.
Yeah, quality.
Yeah. And so I think that could improve a lot of, patients' happiness or their quality of the exam. It improves the rapport, trust, adherence. Lots of different things.
Yeah. And then when you're done, in your case, you're like, write a letter to the referring doctor based upon my findings, and it can generate that letter for you too, which is what a good scribe would do as well.
So I imagine, that's one thing that'll probably we'll see in not just vision care, but
every
specialty. Apply to everything there. I want to take a quick break just to remind you about today's sponsor, MacuHealth. If you are listening to this, then you probably care about eye health just as much as I do. MacuHealth offers a line of incredible supplements that's formulated around published science. MacuHealth is known for featuring the 3 most important carotenoids for your macula: lutein, zeaxanthin, and mesozeaxanthin. Whether you're managing age-related macular degeneration or simply looking to offer your patients a high-quality supplement you can trust, MacuHealth has your back. Now, back to the episode. What about eye care specifically? What's kind of the most exciting things that you're seeing in the research and how that we may be seeing in the near future?
Well, there's so many studies. Again, going back to eye care is just poised for AI because we are image heavy. So therefore it can read that images and give you a diagnosis, but it can go further than that. It can give you potential treatments based on what the patient's insurance has, kind of what that insurance will approve. So someone may have like dry eye, this type of dry eye. It will tell you based on their insurance, you should probably start them with this, more likely to go through. Talking about prior authorizations, it will take that away. And then it can also look at things like kind of the patient's history with compliance. This again depends on how much data you have on the patient, by the way. Or it'll tell you how likely the patient is to be compliant with this treatment, how likely. Basically, I think that probably would be fantastic for glaucoma patients because we always struggle with that as well. So in so many aspects. So yes, right now I think there's a whole lot of attention on the kind of like identifying the disease state, which that is so valuable. Because I don't know of any eye doctor who hasn't sent a picture to a colleague that they trust. Hey, what do you think this is? or what is this? Look at this OCT scan. What is this? And what do you think this is? And so we've already been doing that, but now the AI can sort of be that other aspect that we can utilize. And, when we think about technology, I was trying to think about, there's the whole timeline of AI. There's the timeline of AI in healthcare, and then, timeline of AI in vision care. But I was just actually thinking about technology and vision. And every time like some new technology has come out, how much it has helped further, advance our diagnostic skills and really make everyone much more confident in managing certain patients. So when I was in school, it was so much excitement. I didn't understand it at first. You're like, well, an OCT is out. And now with an OCT, you can see this. And, it was like the old Stratus, which was very pixely, and now
Time domain.
Yes. Yeah. Now you have, I'm naming a certain brand, but yes. But now you have these beautiful, and look how much it's progressed since. And back then, very few people had an OCT, and now everybody has. I mean, if you don't have one, you're in the, minority there. But how do you even I don't know how I would practice without one, in a sense. So, and it's gotten to a point now that I have infused AI almost to every aspect of my life. That and this happens, by the way, so you got to be prepared for that. And I always say this about technology when I do technology lectures: technology is only as good as when it works. That's the same thing when your OCT goes down or when your EHR goes down. What happens? Your day is ruined. So I didn't realize how dependent I had become. I don't want to say dependent, but how much my work was being offset by AI, like just easy stuff, going through emails, writing things like that, until one of my services goes down or it's like not working. I'm like, oh my God, I can't believe this is happening. So I have to write this email all on my own.
So I think what I kind of read that as, it's kind of like calculators and how as a young kid you learned how to do long
That's our
form.
First AI device.
Yeah, right. But how important it is to learn those fundamental skills so that you can do division.
Yes.
You can do long form algebra. Because yes, thankfully we have access to these tools, but what happens when we become so dependent on it and then it fails and then you're in the clinic, you're like, ooh boy, how do I read this again? We don't want that to happen. So
right.
I think it's
right.
an important lesson for us to be like, we have to be able to utilize these tools. But in order to utilize these tools and trust the tool and we have to know the rules in order to know when we can bend them or break them.
Right. And that's where the ethical considerations come into. If, let's say, you're fully dependent on your AI to read your OCT and then to guide your treatment plan, and it's wrong, the liability is still on you. So, yeah, to your point, it's to augment. It's not to be the doctor. At that point, then there's no point for the doctor. You can just have the robot tell you, but no, that's to augment, as it should be. And I think as the best assistant you could ever have.
Right now, are there any tools that are currently available for clinicians outside of a research setting that are specifically AI for like reading fundus images, OCTs?
Yes,
like that?
Yes. So Heidelberg, if you own the HiX2, they have that's basically an AI that you can send your images to, and it can tell you if it's geographic atrophy, diabetic macular edema. It has several ones that can do that. So Heidelberg has their HiX2 that can do that. There's other machines. There's Altruist that can do that. But one of the things to know whenever iNuke, there's a few more I'm forgetting, but there's not a whole there is some, and then there's actually a free service. The ones I'm naming are more, like FDA approved ones.
Sure.
And then there's a free service called CyberSight, and that one does fundus images. You can upload, and it's international. So doctors internationally have been. You can upload your fundus image, but again, you have to know what is that AI looking for. If it's only looking for diabetic retinopathy, it will miss the glaucoma. So in a way, to me, working at an academic medical center, it reminds me actually of ophthalmologists, because they so live in their specialty that, the cornea doc will send me a patient, for example, for a specialty lens fitting, and I'm looking at this patient and go, you got some retinopathy going on too, and they haven't really been addressed. So cornea just sort of lives in. Mm-hmm. So kind of think of the AIs that way. What have they been trained on? Yeah. And so if they haven't been trained to look for the other things, they're not. And same with all the programs that are out there. It will tell you only the ones that they have been trained to look for.
Because it's been more or less programmed or
yes.
designed and built upon pre-existing images that have already been diagnosed or assessed by a human being.
Correct, yes.
So if those human beings who annotated it and selected that, if they missed the glaucoma or if they weren't looking for glaucoma in those specific images, then the AI has learned poorly, so you're going to get kind of that garbage in.
It's only going to look for diabetic retinopathy. It doesn't care if you have a full cupped out nerve. It's just going to say, okay, no, there's hemes or there's no heme, so no diabetic retinopathy.
It's a good lesson.
Mm-hmm.
I think the one study I was reading that I was really blown away by for AI in eye care was a anterior segment corneal, because I can understand the images of retina, retinopathy, that I can understand how the AI could learn very quickly. With anterior segment, and it was using a phone camera. That's what blew me away, is that yes, the cameras we get on our smartphones now are getting more and more powerful, but this was an AI tool with a smartphone that could diagnose an infection. It could diagnose and map out how large an ulcer was to a very fine 0.5 millimeter degree and track it over time and then suggest possible treatments. Mm-hmm. And I'm just like, whoa, this is getting really kind of a little creepy, but impressive, right? Yeah. Exciting.
Yeah, very, very exciting. And, with ulcers, I don't know, that's a tricky one. How does it know what type of ulcer it is? What? So that's one you got to watch, but can it find infiltrates? But, past the anterior seg, but think about your visual fields. Anything that has an image, it can learn from. So visual fields, anterior scans, anterior OCT scans. I hope, AI can do gonioscopy for me. That's I will trust it with that one. But yeah, so anything like that. Yeah.
I think I'm excited to see if AI can detect new disease states or help us understand a missing link. Oh, why is this disease occurring here and it's a slightly variant in this person? And then we end up finding out, oh, it's actually because there's this genetic link that we didn't know existed. And because of AI, we're able to detect that and categorize it, better understand that now. So I think there's a lot that can go there.
Yeah. That's actually, if you were to ask me what, I'm absolutely most excited about, is because of the possibility of new treatments. So all these biopharmaceutical companies, and they all work, they start with they identify a molecule, and then they have to take it through years to see if it's even safe, if it's effective. It just takes years. And then it's not like they necessarily share that data. So somebody else could be doing the same type of thing. It's a waste of resources and funds. There's actually a kind of a campaign for all these companies to provide all of their data. And that is to be fed to AI so it can analyze all of it, and it can probably identify what could possibly be the most effective for this patient and that. And yes, there's probably differences And they can even link it to their genetic, to their genomes. This is probably better for this. So the possibility in that realm is what is truly, I think the way it's going to be very personalized medicine. That's what's the difference that AI can make that we may not be able to right away ourselves.
And I feel like you just answered kind of my next question, is kind of how, of course, it's hard to know because how rapidly things are developing, but what does the future of healthcare, eye care, vision care kind of look like in the near future?
Yeah.
And
personalized medicine. It's going to be very personalized, yeah.
So we're all going to basically have our genome will be decoded, right? And based on all of this knowledge, we'll be able to say, hey, well, because of your genetic makeup, yes, you have this condition, but this specific medication is the best chance of finding this success versus, let's try all these other medications that have all these other side effects. This is the one that works the best with you.
Right. When I think about where I live in Mississippi with such a epidemic of diabetes, I have patients, what is it if they're both doing everything, they're healthy and everything, and one responds really well to this medication and another one doesn't, keep upping up the dose, eventually they're changed. So again, something like that, being able to match that patient right away before that damage starts to happen from this uncontrolled blood sugar. And so, yeah, personalized medicine. And I'm excited about that. I hope it certainly happens in my lifetime. So it will not only will live longer, but I always say it's not about living longer, but it's about living quality. So I'd like to live a quality life longer. And I want that for my patients, for future generations as well.
Free of pain, free of disease, hopefully free of vision loss for a lot of our patients. We hope so. I will kind of switch gears here a little bit. No, AI is fascinating, and again, we could talk about that more, I believe. But you are kind of in a unique position in your career. You've kind of taken a different path. So you work in, correct me, you are at a medical school, a medical institution? How does this?
Academic medical center is what they're referred to as. Yeah, so it's basically a teaching hospital, but we do have a medical school, but it's where we train ophthalmology residents, essentially.
And how long have you been there?
6 years. 6 years, yeah. And it's actually the longest I've ever stayed in one place. So I'm actually really happy there.
Yeah.
Very happy there. Yeah.
What is your role there? How does that work? What does it look like to be an optometrist working in this kind of area?
Well, for one, it's different there's a lot of optometrists who work in this type of setting. So, and it's different all the way around. In some departments of ophthalmology, optometrists are as staff, and whereas in other departments of ophthalmology, optometrists can also be faculty. So that's one big distinction if you're ever thinking about going into academic medical centers. And, there's pros and cons to both. And I really personally like it. The benefit of being in an academic institution is that you have your academic mission, you have a research mission, and you have a patient care mission. So you really get to do a little bit of all of those, or you can choose to do a lot in one section or the other, depending on how you want to allocate your time. So the opportunity for that, I really like. And for someone, I don't want to say I get bored easily or anything, but I like another challenge, or I want to do something else. And so being in this position enables me to do that, whether if it's like, hey, I want to go be involved in more clinical trials, or I want to start this research project, or I want to devote all my time to patients, or hey, I'd like a bigger chunk of teaching. I want to do a lot more of teaching. And so I can do that. But currently most of my time is patient care, and I have an administrative role because I also run the optical and a business kind of perspective. We have a manager who does the other stuff, the day-to-day, but I run the kind of the back-end business part. And then a little bit of research I'm trying to dabble into more, but and then, of course, a big chunk of teaching. And that has been interesting. And I don't know if this experience, you have to tell me if your experience was this. When you left optometry school, or in general, when you thought about it, did you ever have the feeling that ophthalmology knows more than us?
Especially early on.
Yes, yeah.
And I did, and it was it's perplexing because, and I think this can be applied, it's not just ophthalmology, I think it applies to every profession, even outside of healthcare. There are some doctors who push themselves to learn, to excel, to become masters in their field or in a certain area. But then there's some doctors who don't, and maybe don't care as much. And that's okay. But it became a clear distinction to me. Mm-hmm. And so when I first left school, the short answer is yes, I thought ophthalmology knows way more than me. Mm-hmm. But then I started getting to work alongside in my residency and after that, and it was like, wow, there's some ophthalmologists that are just absolute golden star rock stars. Like, they know so much, usually in a specific area, but they recognize that, like, that they're really good at this one thing, but maybe not this other thing, so they refer for that. Mm-hmm. And I respect that. But at the same time, I've also met some, I'm like, wow, I don't want to tell you, but that's an outdated treatment. Like, and
right.
We're all guilty of, I think, that. Right. We can all learn more.
Yes. That was one thing that was, I didn't ever work with ophthalmology prior to being in this role. And I, back from school, I always thought they know more than us, and this is not to, speak ill of ophthalmology or anything. I just didn't know. I didn't realize how much I didn't know about their profession. I had these assumptions. And where I am now, I've learned, they have assumptions too about us. And so kind of learning from each other and learning things like, when I send people to retina, I just don't send them and say, bye, I'll see you later. No, I still need to watch that patient because the retina doc isn't really going to care about this patient's dry eye. And he shouldn't. He's really, should put all his talent and training to that. But that's still an important factor for that patient. So kind of learning all that, learning how much they don't know about us, and then sort of where their limitations are as well. And it's been really nice because, I was prepared when I graduated, to truly be a fully comprehensive primary care physician. And we know a lot. It's not like we know a little bit about everything. We know a lot about everything. And I think that we're very formidable to our counterparts in ophthalmology and many aspects. But they do that extra part where they'll do surgery, mm-hmm. which personally, I never really wanted to do. If someone asked me, I was like, being in that cold OR room, not being able to have nails, kind of priorities, sad priorities, sure. kind of thing. But so that's been kind of nice to be in this setting. And then also to help create relationships with these up and coming future ophthalmologists. So, mm-hmm. I'm here at optometry's meeting, and I'm actually missing our graduation for our residents, which I'm really sad about. But, we've just built such a great relationship. They know when the first day they come, I ask them, do you know what an optometrist does? And whether they know or not, by the time they leave, they know what an optometrist does because they've worked with me and they know what our limitations are too. And so it's been really nice kind of to build that relationship with them as well. Well,
I know I'm really happy that you're there and you're representing us in that way. I'm curious, what classes, what are you teaching the residents there?
So the residents, it's basically, as far as classes, I was actually assigned optics. And I told them, that was my worst subject in school. Optics? Who uses optics? No, optics are important, but I had to go back and relearn it to teach them. But independent of optics, I'll teach them all their kind of foundational things, a lot of primary care things, contact lens. And then they also rotate with me in their very first intern year. So that time, and just like optometry students, when I was at an optometry school, there's vast differences between them. They all graduated from med school, okay? But they're all different. Like one will know so much and one will almost know nothing. So it just depends on where you start, teaching them everything from the slit lamp, doing Goldman tonometry, and doing their indirect. We call it BIO, but they go indirect. So if you say BIO to them, they don't know. So they're indirect. And so I teach them all those things, and then I leave ophthalmology to teach them everything surgery, essentially, which they'll start later.
Well, it's great to hear that and get that perspective.
Mm-hmm. Yeah.
Now you have an interesting just path. I'm just curious because you went from optometry school, and then I know at some point you ended up you went from being a student to a graduate to working, but you also ended up working at an optometry school.
Yes.
in administration in some way?
Yes.
Can you just share us that, because it's a very interesting path.
So, we started out at the top of this interview, and you mentioned, I was your TA, and that was in my, third year, and I was going to go out through which I really liked being a TA. And then when I went out an externship year and actually saw patients all day, by the time graduation came, I knew that I didn't just want to see patients. And I was mortified. I was like, is that all that I can do? And so for 1 year, I didn't really land anywhere. I worked several different places, from corporate to private practice, and I was a short associate at another practice, which was a nice practice, but I knew it just wasn't for me. And then I got this great opportunity to go into the new school in Kentucky, the Kentucky College of Optometry. At the time, it hadn't started, and to be a part of the administration there. I was hired on as the Assistant Dean of Student Affairs, which was so much fun because, I felt like I was just a student. I had just gone through that experience of being in inaugural class. So I knew, certainly from the student standpoint, the sort of pitfalls and the things to look out for. And so that was really nice, building that program there. And I enjoyed it. However, again, I got to a point where I felt like that was all the growth that I was going to get there. And I wanted to, lecture more and kind of do other things. But I knew I still liked academia. And I didn't want to go back to practice. And I didn't necessarily just want to be in a research role. So I thought, what would be great? I just put it out into the world. I would like to work in a medical school where I can kind of do a little bit of everything. Because the truth is, when you're in administration and when you're just teaching optometry students, you start to lose that patient interaction, that perspective. So, that really, I really feel like you should still, be engaged in that when possible. And so I thought, that's what I want. And then it's a very serendipitous how it all happened. And then my other thing was, I have to be in the South because I want to be someplace warm. I couldn't believe it snowed in Kentucky when I moved there. In my mind, it didn't, especially because it was South Kentucky. So when all the snow, I just couldn't take another.
Things shut down, I'm sure.
No, they were very well prepared, but it's like I couldn't tolerate. There was a lot of snow. And then, of course, there wasn't an airport there. That's what made it difficult if you do want to travel and, go to different conferences and events. So I was like, I want to be in the South. I want to be where it's warm. And I want an airport. That was it. So this opportunity came, and to be the very first optometrist hired at the only academic medical center in Mississippi, which, if you think about it, it's, who would have thought? I live in Mississippi. It's just such a odd thing. But I do have a joke though. When people ask me why did I move to Mississippi, I always tell them it's because it's the state that has the most eyes. Joke.
That is good.
There you go. That's my joke. But yeah.
Well, Roya, thank you so much. There's so much we can talk about. Again, you've got just a wealth of experience and knowledge in so many areas. But to kind of round out the podcast, it's called I Give a Damn Podcast for a reason, because you're somebody who does give a damn about what you do and in our profession. The final question I have is, if you were elected tomorrow as the Surgeon General of Optometry, you were going to represent and lead optometry on like a grand scale for our nation, what would be your one task, your number one thing that you want to make a change, either for the profession or for the public? What's that one thing you would focus on?
Wow, that's a good question. I would like to, and this has been done before, but it's never quite been effective. I would like to make it sort of imprinted in every citizen's mind, the importance of an annual comprehensive eye exam. That's so important. I personally didn't have an eye exam until I went to optometry school, sadly, but I had good vision, and I just have seen so many people that did not. But I wouldn't have known what vision should have been, because you see a lot of children that may not have good vision, but they don't know it because they never complain. That's how they think the world is supposed to be seen. But I'm just so surprised if, we learned that, 80% of our learning as a child comes through vision. And it's also been shown that in older age, individuals who lose vision also have quicker cognitive decline. Mm-hmm. So, if you ask anyone, that's like one of the top fears, one of those top fears. So with those so many aspects, why do so many people still not get an eye exam? What's their limiting factor? And I actually did my research project on this when I got my second doctorate last year.
Congrats, by the way.
Thank you. And what do we always hear are the reasons people don't get an eye exam?
Probably number one is that I see just fine.
Very good.
I'm going to guess time, maybe?
Time? I've always heard it's like money, access. It's always those things. It's always the things that they try to make an impact and change. And after years of experience, I've seen that it doesn't matter if the individual has insurance, money, access. It's what you said first. Like they think their vision's fine, because people judge their visual health by their vision, or their eye health by their vision, and that's not correct. And when they do that, they don't even do it monocularly. At least do it monocularly. But so I would just like to make that sort of kind of imprinted in everybody's mind. I always like to refer to our colleagues in dentistry. I feel like they've done an amazing job, because everyone, like, I haven't been to the dentist. I know I'm supposed to go twice a year. Are you? You have so many teeth. If you lose one, is it so bad? They could give you a prettier one. No, it is important to go. But if you lose an eye or anything, just like anything, we got to catch it sooner rather than later. And so I don't know where that education has been lost. But my research study found that if you eliminate the factors of like access and intelligence, like a lot of times they'll say like people don't have health literacy. So intelligent individuals, my population were all medical center employees. So they're around medical stuff all the time. You assume they're all educated. They all had insurance, and they all had they're all close to somewhere to get their eyes examined. And despite that, all the ones that did not cited the same reason. My vision was fine. I had no need to go, kind of thing. So as Surgeon General, it is my hope to change that, that everybody will have an eye exam. So
I think
whether
that's
it be by us or an AI doctor. No, it'll be augmented by an AI.
I personally always just try to explain of how the eye is an extension of the brain. And like what's more important than your brain and your brain health. And it's hard to still, I think even that people are like, when's the last time you saw a neurologist? Well, it's really hard to get in.
Yeah,
you don't want to waste their time either. But so that, I definitely think that is a major thing.
Yeah.
So
Yeah.
well said.
Thank you. Oh, can I make a recommendation for your future videos?
Please.
I would love to see a video with all your bloopers.
of the podcast or
no, your personal. Yes, Dr. Eye Health.
One.
Yes,
okay.
all your bloopers. That would be real fun.
Oh,
all of our bloopers would be fun too. That would be fun.
We didn't really have too many, thankfully. But
from all your different guests. That would be funny.
Yeah, bloopers. I've had some older bloopers in some videos, especially with the cat I used to have. And people love those sort of things.
Yeah.
I think the reason, and this is just getting off topic, but there's always this fear of people seeing the imperfect you, right? And sometimes I'll leave them in because they're funny, but sometimes I'm like, you don't realize how many times I recorded this little shot. It's like I recorded that like 30 times. And that's the one you're seeing is the best take. So people don't see that in the background, but
I think we would have a better appreciation for it because you make it look so easy.
I'll see what I can do, and I'll give you a shout out in that. So
yeah.
Thank you again, Roya. I hope you enjoyed the rest of your event here at Optometry's meeting, and hopefully we'll maybe have you on again as a guest in a second time.
Thank you. Appreciate it.
So that was our episode for today. Thank you so much for tuning in. If you are somebody who is deeply passionate about our profession or gives a damn about a specific topic that may be affecting our industry in some way, please let us know either in the comment section over on YouTube or in the review section. Leave us a solid review on whatever your favorite podcasting platform is, and let us know if there is a person in our industry that you would love to hear from, or perhaps a specific topic that you would like to hear in more of a deeper conversation on this podcast. Otherwise, thank you so much again for listening in. I hope you have a fantastic day, and we'll see you in the next episode.